Disclaimer, friends, this video is an informations only. Please consult your doctor. मित्रों, मेरा ये वीडियो सिर्फ माहिती है. अपने डॉक्टर को कंसल्ट करें. तौबा ये मत वाली चाल, झुक जाए फूलों की डाल. तौबा ये मत वाली चाल, झुक जाए फूलों की डाल. चांद और सूरज आकर मांगे तुझसे रंगे जमाल. हसीना तेरी मिसाल कहाँ. तौबा ये मत वाली चाल. Friends, when I was studying physical therapy, we were taught about gait. Gait means chal, how we walk, and scientific analysis of gait cycle phases. The limb on the ground, that is stance phase, and the limb in the air, that is swing phase, and the percentage and everything. Also about gait deviation because of the pain or paralysis in the limb or the body. But never taught about मतवाली चाल. तो ये तो कमाल है. मजरूह सुल्तानपुरी जो लिरिसिस्ट थे, उसके इमेजिनेशन से उसने मतवाली चाल का डिस्क्रिप्शन किया है. फिल्म थी पत्थर के सनम 1967. मनोज कुमार, वहीदा रहमान एंड मुमताज लव ट्रायंगल. Song was sung by late great Mukesh Kumar ji. Anyway, we will go to our original subject, the scientific study of gait cycles. It is free, friends. Please see below my video and press subscribe and bell button. It is free. You will get my videos automatically. Thank you.
The ability to move around is very important to our ability to function. For many people, this involves ambulation or walking.
एक मिनट, हकीकत या हास्य. यहाँ हकीकत. व्यक्ति अपनी जिंदगी में सरेराश 65,000 माइल्स 104,000 मीन्स 1,04,000 किलोमीटर चलता है. जो पृथ्वी को 3 बार प्रदक्षिणा करने के बराबर है. नॉर्मल GAIT gait चाल phases. The difference of the spellings. GATE main entrance or main door. GAIT gait means walk pattern. There are 3 main phases. Stance phase when one leg is on the ground 60%. Swing phase when one leg is in the air 40%. Double stance phase when both the legs are on ground 10 to 20%. Slow walkers will have more double stance. Fast runners will have less double stance. Now this is one example of right leg. Number 1 will be heel strike of the right leg on the ground, then foot flat right leg, double stance push off of the right leg, toe off of the right leg and then swing of the right leg again. Heel strike of the right heel. See here, yellow color leg is right side, and initially there is a stance phase of 60% and a swing phase of 40% and in between 10 to 20 phase of double stance. Here the gait cycle, that is stride, and one is stance phase and other is swing phase. Gait analyzer. Gait deviations means abnormal gait. Number one is antalgic, due to pain in the leg. Antalgic gait. Patient has pain somewhere in the limb and patient do not take proper weight on the affected limb. Number two, fascinating or Parkinson disease gait, short steps and shuffling. This is a fascinating gait and it is because of the disease Parkinsonism, and patient has a short shuffling gait with a stoop posture. Number three, ataxic or drunkard or wide base and reeling gait. Ataxic gait or a drunkard gait or a reeling gait, there is no control on his body anywhere. It is because of the extra pyramidal lesion and patient walks without any pattern. 4. High steppage due to the weakness of foot dorsiflexors muscles. High steppage, this is because of the weakness of the foot dorsiflexors. So when patient takes the limb, he has to take little higher because there is a foot drop. So this is called a high steppage gait. Calcaneal gait, weakness of gastrocnemius muscle, that is calf muscle, and there is no push-up at heel. So calcaneal gait because of the weakness of the calf muscle and patient, there is no push-off. So patient walks, there is no push-off. Myopathic or waddling gait, side to side leaning while walking like penguin gait, weakness of hip and thigh girdle muscles. So myopathic gait, there is a weakness and paralysis of the hip girdle muscles and thigh muscles, and patient has no control on the hip joint and patient bends side to side for walking. It is like a penguin gait. Hemiplegic or circumductory gait, paralysis of the half side of the body. Hemiplegic gait, paralysis of the half side of the body because of the pyramidal trajectory, and patient walks with a circumductory gait. Arthrogenic or stiff knee gait, or any joint in the leg which is stiff. Arthrogenic gait, patient has stiffness of the joint in the limb anywhere. For an example, if there is a stiffness of the knee joint because of the arthritis, patient will not have hip and knee bending and will walk with a stiff leg. Hip abductors, gluteus medius and gluteus minimus muscle weakness. Trendelenburg sign gait, dropping of pelvis on opposite side. Hip abductor weakness gait, it is called Trendelenburg sign. When there is weakness of the gluteus medius and minimus here, when there is a weight bearing on the right side, patient will not be able to hold the pelvis up, so it drops on the opposite side. In female, it is bilateral Trendelenburg sign present because they have a heavier pelvis because of the childbirth, and they have a bilateral Trendelenburg. They walk this way. hip extensors, that is gluteus maximus muscle weakness, and the gait is called lurching gait. Maximus weakness gait, that is called lurching gait. If there is weakness here of the gluteus maximus on weight bearing, and when the other limb is in the air, this maximus muscle keeps the body hip in one line. But if there is weakness when there is weight bearing, it will lurch back. Spastic seizure gait in cerebral palsy means damage to the growing brain of a child. Diplegic, all four limbs are affected. Upper limbs are better than lower limbs. This is a seizure gait. It is found in spastic cerebral palsy, means injury to the growing brain of a child, and patient has paralysis or all four limbs. Upper limbs are little better than lower limbs, and patient walks with the stoop posture and crossing the leg. This gait was not taught to us in our medical studies. Torn chappal gait. Torn chappal or footwear gait. Suppose on the right side, patient will be easily lift the limb up, but on the right side, he has to drag the foot and the footwear on the ground. 12. Walking with. Number A. Parallel bars walking. Walking with walker or rollator. Walking with auxiliary crutches. The spelling is not CLUTCHES. Clutches, that is scooter clutches. D. Elbow crutches. E. Canes. And F. Artificial leg, which I will show in my next videos.
Walking slings are used to assist patients in weight-bearing, ambulation, gait training, and fall prevention. They are intended.
Step into the walker with your good leg.
Make sure you're heel to toe, looking forward, trying to walk as normal as possible.
Crutches. And as always, when you get
Then
done,
I'll show you the next progression of that, which is the crutches forwards, the operated leg, and the good leg comes all the way through. The crutches, the operated leg, and the good leg.
Gait training with artificial leg.